This is the second in a series of presentations on radiography of the skull in veterinary patients. The intent of this presentation is to describe and provide examples of the radiographic diagnosis of various types of nasal disease in the dog and cat. And by the end of the presentation, I want you to be able to distinguish between non-destructive and destructive rhinitis or rhinosinusitis, as well as evaluate for and identify potential underlying causes of the rhinitis. Before we get started, I wanted to just call your attention to kind of a concept that you should keep in mind as we're evaluating our radiographs. On this slide, we're going to use the ventrodorsal open mouth view of the nasal passages, and this happens to be a dog because this is really the best view for us to assess the nasal passages without superimposition. The concept that I want to draw your attention to is that in the rostral nasal passages, the patient has soft tissue nasal turbinates. So we'll see these fine little lines of soft tissue, which is comprising those nasal turbinates. And then obviously there will be air-filled passages between those as well. There is this kind of M-shaped little line of bone or sclerotic region that's usually at about the level of the third maxillary premolars. And we're going to use that as a demarcation between the rostral part that has the soft tissue nasal turbinates and the mid and caudal part of the nasal passages, where we're going to actually now find the osseous structures, the conchae and the turbinates, and especially the ethmoid turbinates. So those structures have larger bony margins. Notice down the midline too, not only do we have a soft tissue nasal septum, but you'll also have the osseous vomer bone, and that really starts at this level as well. Rostrally, if we have a fluid that might be mucus or hemorrhage or mucopurulent, that fluid can actually silhouette with the soft tissue of the nasal turbinates, and we won't be able to see them in nasal disease. But if we have fluid in the mid and caudal nasal passages, again, it might be mucopurulent, it might be hemorrhage, mucus. It cannot silhouette or shouldn't silhouette with these large osseous structures. So fluid by itself will still be able to see these osseous structures. Keep that in mind as we talk about the different types of radiographic categorization of the non-destructive versus destructive rhinitis. Let's start with non-destructive rhinitis or rhinosinusitis, and on radiographs, this will most often present with fluid or soft tissue opacity within the affected regions. It can be bilateral or unilateral, can be focal or diffuse, and it just depends upon what process is underlying the rhinitis. Again, the osseous structures should be spared, with rare exception. I'll come back to that. There are a lot of potential etiologies for non-destructive rhinitis that I've listed here. It can include infections or foreign bodies. In the cat, specifically, remember nasopharyngeal polyps. Allergies and lymphocytic, plasmacytic rhinitis occur. Dental disease, and certainly I'm not going to talk about dental disease in dogs and cats. We'll leave that for your dental lectures, but dental disease can certainly be a cause of non-destructive rhinitis. And then although a patient with coagulopathy really doesn't have rhinitis, they may present with epistaxis, and you may take radiographs before you recognize that they have a coagulopathy. And so hemorrhage can cause this non-destructive rhinitis findings. This slide lists the possible radiographic findings that we might identify in non-destructive rhinitis. And the main thing, again, is that we're going to see abnormal fluid or soft tissue opacity within the affected portion of the nasal passages and potentially the frontal sinuses if they're involved. In the rostral part, where we have those soft tissue nasal turbinates, we may lose clarity of those because they can silhouette with the fluid that's in the nasal passages. And we should not see lysis, so our osseous structures should be spared. However, the caveat is that we may see very minimal lysis if we have a very chronic case of severe infection or foreign body leading to that rhinitis. Rarely we may see foreign material. Foreign material will not be identified if it is, like plant material, sticks, or grass awns, because those will become waterlogged and they'll look just like all the other soft tissue. So we'll only identify foreign material if it is of mineral or metal opacity. So let's take a look at a couple examples. So on this slide, I have a cat that actually has non-destructive rhinosinusitis on the right that is secondary to a nasopharyngeal polyp. Let's start with our middle view here, which is our ventrodorsal open mouth view. And in this patient, I can look for right side to left side and see if there is any differences between the two. And when I look at this right side, this side actually has too much soft tissue or fluid opacity within much of the nasal passages. So the left side is normal in this cat with a lot of lucency from the air and then the osseous structures. On the right, I can see this more kind of diffuse, but not quite affecting all of it, soft tissue opacity. In the rostral part, kind of silhouetting with some of these soft tissue turbinates. In the mid and caudal part, I can still see my osseous structures. So this is fluid opacity. When I look at the rostrocaudal frontal sinus view, this patient also has affected sinusitis. So on the right side, there is increased soft tissue or fluid opacity compared to the air-filled left side. In this patient, this is fluid. I can still see osseous structures. Sometimes you can actually have a mass up in the sinus, and if there's no destruction, it might be hard to tell if it's fluid versus mass. A lot of times fluid will build up because there's something that's obstructing the drainage of that frontal sinus. Now, all I can see on these views is just that we have non-destructive rhinosinusitis on the right. When I look at the lateral view, again, everything's superimposed, but it's a good kind of global view. We can look at margins of structures. We could look at the frontal sinus and the nasal passages, and we may be able to identify something on that. But what I really want to call your attention to is that you should always be evaluating the nasopharynx. So nasopharynx, partially superimposed by the mandible, should be fairly uniformly air-filled, with the exception of where we have superimposition. Soft palate is right here. This is a little bit overexposed, so I can't see the retropharyngeal area and the rest of the pharynx. But in this patient, I actually can identify this little soft tissue mass, which actually is the patient's nasopharyngeal polyp. I would look at this patient clinical presentation. If this is a young patient, it's much more likely that this will be a nasopharyngeal polyp than, say, something else like a tumor mass. In this case, it was a nasopharyngeal polyp, and those polyps may oftentimes be more caudally located as well. But again, I draw your attention to always assess that nasopharynx. In the presentations, we will oftentimes have a follow-up slide with labeling, and that really is for your review. Here's another example. This is a dog that's presenting with chronic sneezing due to a diagnosis of lymphocytic plasmacytic rhinitis. On this dog, when I look at this ventrodorsal open mouth view, the rostral nasal passages are bilaterally symmetric and normal. As I move back into the mid to caudal nasal passages, I notice that there is kind of a focal region of increased soft tissue or fluid opacity on the right as well as on the left. Notice again, I can still see the osseous structures here. So this is just really some sort of fluid opacity, maybe some thickening of the lining of the bony turbinates, but certainly there's no loss of bone. On the left, there is even a little focus, or maybe 2 or 3, of mineral opacity that I don't see on the right side. On the frontal sinus skyline view here, not quite positioned as nicely as the cat was. I can see pretty air-filled sinuses, and the bones look okay. On the lateral view, again, always look at that nasopharynx. I don't see anything in the nasopharynx. I can see the rest of the pharynx in the retropharyngeal area. We're going to look at the outer margins of our nasal cavity. In this patient, I probably can identify that increased soft tissue opacity here in the caudal nasal passages and that little area of mineralization. In this patient with follow-up rhinoscopy, we identified that that mineralization was dystrophic mineralization, so not foreign material, but it is possible that foreign material like gravel could look like that as well. So now let's discuss our destructive rhinitis. And destructive rhinitis or rhinosinusitis on radiographs is going to present most often with a soft tissue mass and regional lysis of the osseous structures. We do want to keep in mind, though, that radiographs can be relatively insensitive for nasal disease. We have talked before that we have to have quite a bit of lysis in order to see it on radiographs. And we also have to have a pretty big mass for us to identify it on radiographs. So very early lesions of destructive rhinitis could mimic what we've already seen on non-destructive rhinitis. There really aren't a lot of etiologies for destructive rhinitis. So an important thing to think about is neoplasia whenever we identify destructive rhinitis. And certainly there are different types of neoplasia. Probably the most common is epithelial neoplasia, which would be our adenocarcinoma, squamous cell carcinoma, or undifferentiated carcinoma. However, patients can also have mesenchymal neoplasia, which includes fibrosarcoma, chondrosarcoma, and osteosarcoma that actually arises in the nasal passages, not specifically of the bones. And then nasal lymphoma also occurs, and maybe more commonly in cats, but in dogs as well. Neoplasia is going to typically affect our older dogs and cats, so we can prioritize that in our older patients. Fungal infections occur, and aspergillosis is pretty common in dogs and certainly can happen in cats. In dogs, this typically is going to affect our younger patients, less than 4 years of age. So if we have that young of a patient, we're going to think about fungal infection. It also is more common in our non-brachycephalic dogs. Cryptococcus is the more common fungal infection in cats, and again, might be more common in our young cats. Certainly in our area, I have identified blastomycosis as a nasal fungal infection that's just less common. This slide lists the types of radiographic findings that we're going to hopefully identify. Certainly, we're going to see most of the time that there is some sort of irregular soft tissue opacity or mass in the nasal passage and oftentimes the frontal sinus. Again, when we have increased fluid or soft tissue opacity in the frontal sinus, it may just be fluid because it can't drain that's being obstructed by the mass within the nasal passage, but it is also possible that it is extension of the mass into the frontal sinus. With destructive rhinitis, we're going to start to see lysis of the osseous structures, and those osseous structures involved would include our palatine bone, our maxilla, and certainly the larger bony turbinates or ethmoid turbinates, maybe even our vomer bone. Most of the time, our nasal tumors seem to have a predilection for the maxillary recess and the caudal nasal passage by the ethmoid turbinates. So that means that we're going to find our mass kind of in this area as depicted by this orange circle. So our maxillary recess is usually about the level of the third premolar, and then our ethmoid turbinates are back in the caudal nasal passages. So in this patient, there is this kind of poorly defined soft tissue mass in that region. And if we look, I'm starting to lose the larger bony structures that I can identify on the normal left side. So that means that there is lysis, because remember back here, fluid should not be able to silhouette with our big bones. So there's definitely lysis as soon as I can't see them. There are also some other areas of lysis that's a little bit more moth-eaten here as well. Remember that we were using that margin of this kind of M sclerotic line to stay away from the soft tissue rostral nasal turbinates in demarcating them from our larger osseous structures. And then we want to look for extranasal extension, which is going to be identified maybe even more easily on our lateral view. And so this might be going dorsal to the frontal and nasal bones. It might be also out where the orbit area is. In this open mouth ventrodorsal view, this is the region of our frontal sinus. So on the left side, it's still pretty air-filled. On the right side, there is actually soft tissue in that area. So here's a dog with pretty destructive rhinitis that is due to a nasal adenocarcinoma. I didn't give you the lateral view in this patient, but here is our open mouth ventrodorsal view. This patient has soft tissue opacity in both the right and the left kind of mid to caudal nasal passages. On the right side, I am starting to lose the ability to see those larger bony turbinates. And so this soft tissue opacity is caused by a mass that also has associated lysis. This patient actually has a large geographic area of lysis kind of in the nasal turbinate, which would be more the soft tissue area, but that's all lucent there just because the palatine and probably part of the maxillary bone is just lysed away. Notice on the left, I can see the soft tissue faint lines of the soft tissue turbinates. The left side has increased soft tissue opacity, although I still do see some of those larger osseous structures. So some of this might just be fluid, but I can see these areas of kind of lysis on the left. And probably even some of the vomer bone is mildly lytic because it's not as thick rostrally as it is caudally. On the rostrocaudal frontal sinus view, the right frontal sinus has increased soft tissue opacity, whereas the left one is normal. And then if you critically look at this one, there's actually lysis of this frontal bone. And so that tells me that this soft tissue opacity has to partly be the mass leading to lysis, not just fluid. We obtained an oblique view of the nasal passages in this patient, and this oblique view just depicts all of this lysis of this palatine and maxillary bone, both on the right and the left side. Although it is around the teeth, this is much more extensive lysis, and in light of the mass that we identified in the frontal sinus lesion, to just be from dental disease. Here's another example of a dog that has destructive rhinitis that is from nasal tumor, nasal adenocarcinoma. In this patient, unfortunately, they only obtained the closed mouth ventrodorsal view, and you can see why this isn't as beneficial of a view because the mandible is superimposed over a lot of our nasal passages. However, in this dog, we can still see that there is increased soft tissue opacity that is predominantly right-sided. Rostrally, it's kind of silhouetting with some of the nasal turbinates, but back here in the kind of caudal area, although some of the very large osseous structures are present, compared to the left side, a lot of the thinner osseous structures are no longer present. So that tells me that this is a soft tissue mass with actual lysis. There's also soft tissue opacity in the right frontal sinus. Compare that to the air-filled left frontal sinus. Now this is the area of the cribriform plate, and we always want to assess that area to see if we can see lysis there, because that might help us with extension into the the cranial cavity there, the cranial vault. I don't specifically see any here, but that can sometimes be challenging to pick up. Here's the lateral view in this patient. Although I see some kind of vague increased soft tissue opacity, I can't really see the lysis as well in the lateral view. And again, that's because things are superimposed. But again, because I critically want you to look at the nasopharynx, this patient actually has kind of this soft tissue mass that's coming from this nasal tumor in the rostral part of the nasopharynx dorsal to that soft palate. Here's just an example of 3 different transverse images through the caudal nasal passages in this dog, showing you how much more easily we can see that mass in the right side of the nasal passages, and we can see that it extends caudally. And then this soft tissue attenuating mass right here is the mass that we see in the rostral part of that nasal passage. Here's an example of a dog that just has a very early mass. And so this one is just showing us that it can be difficult to identify destructive rhinitis if you're very early. So I just have the open mouth ventrodorsal view of this dog. On the left side, there is this kind of faint area, focal area of increased soft tissue or fluid opacity without really any definitive lysis. Maybe if we look at the right side, this osseous shelf, that's probably a little bit lytic, but it'd be challenging, I think, to say that this patient actually has destructive rhinitis. But I have a dorsal image through the similar area that we're looking at on this dog. And there is actually quite a decent sized mass here, and this mass actually extends into the cranial vault. This is the brain here, and we can see extension of that. So the CT really does demonstrate that nicely and shows that very early lesions may not be as easy to identify. Here's an example of a dog, just two of the views in a dog that has aspergillosis. And one thing that is a little bit different about aspergillosis is that the most common feature includes a lot of lysis, almost cavitating like lysis of the conchae, and maybe some punctate lucencies of the bone. So in our open mouth ventrodorsal view, the right side is normal, so this patient has unilateral disease. Notice that there's quite a bit of lucency in here, which is this large kind of cavitation of lysis. And then oftentimes these dogs have kind of smaller nodules of soft tissue, which is the granulomas of the fungal disease. And so kind of this area depicted by the arrows are these kind of nodular soft tissue opacities that are the kind of fungal granulomas. Another thing that we might identify with fungal infection, so this is our rostrocaudal frontal sinus view, is that not only is the frontal sinus kind of a predilection for infection, and so we have quite a bit of increased soft tissue opacity in this left frontal sinus, osteomyelitis is a feature of this. And so the bone oftentimes has findings of osteomyelitis that we've already talked about, where it can be thickened from periosteal reaction. And in the frontal sinus, it's going to happen on the internal part of the bone. So this is our normal right frontal bone. And here, if we look on the image to the right, we have thickening of that, or sorry, the left frontal bone to the right of the slide with thickening of that frontal bone. Here's an example of a cat that has destructive rhinitis that is due to coccidioidomycosis. I have a ventrodorsal open mouth view. This cat has pretty diffuse disease, right and left-sided, so almost all of the nasal passages here have increased soft tissue opacity. But if we critically look, there's extension externally on the right, so increased soft tissue opacity, and then there are areas of lysis that are affecting the maxilla here on the right. Also, this is the palatine bone that has lysis on the right compared to being able to see osseous structures on the left. And then if we look at this lateral view, here's a good example of why I like the lateral view to look for extranasal extension. If we look dorsal here to the kind of nasal and frontal bones, here is a focal soft tissue mass that actually has some gas within it. And so this mass is part of the infection, and then also the gas coming from that extranasal extension. So there's some communication with the nasal passages. If we critically look at the osseous structures here, there's actually that part of a periosteal reaction, and then probably a little bit of lysis here associated with that infection. Certainly, I want you to look at the textbook chapter and pages here, because you'll be able to get some further explanation as well as some additional examples. And just seeing more examples is going to be very beneficial when we're looking at destructive and non-destructive rhinitis.